Hello, everybody. I'm Ryan McMahon, Onondaga County Executive, and in part of this ongoing issue with the coronavirus, specifically the COVID-19 strain, we're going to be doing daily updates via Facebook Live so we can communicate up-to-date information to the public. You also can go on our website at www.ongov.net, click on our health department link, and then you will have various frequently asked questions and ongoing guidance from the Center for Disease Control. And if you have any other questions that come up throughout these, you can always call 211 and get your questions asked and answered. With me today is our Commissioner of Health, Dr. Indu Gupta, and our Commissioner of Emergency Management, Dan Weirs. And I think for the public overall to understand that we have a team of professionals here that works year in and year out on what to do and prepare and plan for different types of emergencies. And really what they do is then once you have something in front of you, then you plug that situation into what these plans are, and then you execute on these plans. And so emergency management planning for our community is not new. We do it very well. And over the past really 3 weeks, our teams in the health department and our EMS teams have been coordinating with various stakeholders in the community. We've had numerous meetings with school districts, with local governments, with nursing home providers, working with our medical community to develop various plans to help be prepared for a potential case of the COVID-19, and then how do we respond. And I think there's a couple of things that as a community we can all do to help make, and really risk management is really what we're doing right now. And that is, first off, if you're sick, stay home. Second off, if your child is sick, have your child stay home. And certainly if you are sick and you have some of these symptoms of the flu, which are very similar to the COVID-19 strain, certainly we need you to call your primary care provider. And Dr. Gupta is going to talk a little bit about that shortly, but we don't need anyone just showing up at their doctor's office, showing up at the emergency room. We need you to make that phone call and talk to your doctor who knows you best. Also, for businesses and families, let's think about a continuity of operations. So for your businesses, certainly what happens if there is a community spread where there's multiple cases throughout the community, and you have a situation where there are self-quarantines where people may have been in contact with somebody who, or may not, but they need to be self-quarantined for a period of time. Can they work from home? Prepare for that so you have technology for that. But also for families, start to think through these things. Start to think in the event that there's a situation and you have to be self-quarantined, or your children for a period of time. What does that look like? Do you have family members that can help you with various needs, whether it's medicine, whether it's dropping off food? Certainly there's a lot of technology these days that allows for the commercial space to bring foods and groceries to your front door. But these are the things, just as a community, we just need to start thinking about. But really, when it comes to the current state of affairs, we don't have any cases of COVID-19 in Onondaga County. And there's no cases in central New York yet either. We do have 19 individuals that did travel outside of the country, and because of that, they are in a self-quarantine. So there's a period of time that they're going to be self-quarantined in their homes until they've gone through a period and they're not symptomatic of any COVID-19 symptoms. And right now, with our robust medical infrastructure, we have the ability for testing, and that testing, once it's done locally, gets sent off to different labs throughout the state, and we're seeing turnaround times that are acceptable at this point. So really right now, the information hasn't really changed from yesterday's briefing that we gave, but this is really about planning for your families, planning for your businesses, and being prepared and being smart. We should all be washing our hands. We should all be, disinfecting our households and our homes and our places of business. If you have loved ones that you look out and look after, the same should be done for them. And this is all about trying to do everything we can so that we don't get a community spread. And in the event, at some point, if we have a community spread, we'll look at different social distancing policies that we'll implement at that time. But right now, there's no reason to panic. There's been a lot of planning and preparation done with all of our partners, and we still got to go to work every day. We still got to go to school when healthy, and certainly there's still an economy here locally that we need to support as well. But I want Dr. Gupta to give us some specifics on, if you're not feeling well, what you should do and what that would look like. So, Doctor?
So at this point, I think we are in very preventive mode. So prevention is the key. As County Executive has mentioned, that one needs to not just to walk into the emergency room. So there are a few things. It's important. It's still a flu season. People are having symptoms of cough, shortness of breath, and sneezing, and all those things which pretty much align with the flu. So if you have any of those symptoms, and if you have traveled or not traveled to the United States, that's also plays a factor in there. You have to pick up the phone and talk to your primary care doctor. It is so crucial. And give them the full information going from your travel history, your contact. If you were in quarantine, that some of those people we will know, we will not know all of them, and get the guidance from them. If the doctor is suspicious about certain things that you need to be tested, they will contact with the hospital or with the local health department, and will be able to provide the further guidance to the patient in terms of what to do, how can they get the testing, because testing is not available at the primary care offices at this point, and that's being done at the emergency room at this point. So we don't want to overrun the emergency room with the people just for testing. That has to be really appropriate screening done by the primary care provider. So it is very crucial for people to get to have the phone call with their doctor and give very thorough, very clear history. One of those things I think I want to emphasize in addition to that is if you have traveled, especially on my ask of those individuals who have traveled from 5 countries, which is China, Japan, Italy, Iran, and South Korea, is that to self-quarantine for 14 days and make sure that take your temperature, and if you have any symptoms which might be suggestive of flu-like symptoms, please call your doctor and get the further guidance. You can call health department as well. If you don't have any primary care doctor, we certainly can give you further guidance. But do not just run to the ER. That is a very crucial part of that. As a reminder, 80% of people have mild symptoms, and what we want to do is protect those 20% who actually will have very severe consequences of the COVID-19. Elderly, those people have underlying disease like diabetes, those on dialysis, and all those, that becomes very uncomfortable. So the travel history has to match with the symptoms, and then a conversation with the healthcare professional is the key in terms of trying to prevent and do all the measures which are self-protective for yourself in terms of hand washing. Stay home if you are sick, or you keep the children at home if they are sick, and have a conversation with the doctor and the local health department as appropriate.
And a couple of things I think just to highlight for many of these cases that we're hearing about and learning about in other communities, 80% of these cases, even when they have and are infected with the COVID-19 strain, are in their homes, and they're being mandatorily quarantined in their homes. So for most people that come into contact with the virus, they're not in the hospital. For our most vulnerable, certainly that's a different set of circumstances. And the other thing too, just to play forward a scenario, if you contact your primary care physician and they tell you, look, I think you're sick, the symptoms are here, we want to get you tested, and you don't feel well enough to take yourself there or whatnot, and you have to call 911, it's very important that you let the 911 dispatcher know that I talked to my primary care provider, they need to get me tested for COVID-19, because that communication will be transmission on to our emergency management folks, and they'll know to properly protect themselves with the proper gear to make sure that there's not a potential community spread that way as well. So right now, we are in contact with all of our partners throughout New York State and the federal government, all the various counties. I've talked and spoken to many of the county executives that are dealing with this issue, and we're learning and we're seeing and getting good information on what other communities are doing. Again, right now in our county, we don't have this situation here yet, but we're planning and preparing for the event that it does come here. And for more continued information, please go to our website, www.ongov.net, click on our health department link, and also you can 211 is a phone number you can call. And in addition to that, we'll be doing these daily briefings and certainly larger briefings if there's any material changes in the circumstances on the ground. So thank you all, and please stay in touch and take care of each other. Thank you.